The reality is that the only thing an IVF patient wants is a baby. And they also know that the best way to get a baby is to find a good IVF doctor. That's not just simple. Because after all, no IVF patient is going to be able to do IVF for themselves in the bedroom. You need a doctor. The problem is there are so many doctors around, so many websites, so many ads, so many billboards, so many people claiming they're the best IVF clinic in India, which is why patients get confused. And the problem, of course, is all these websites look exactly the same because they all pretty much copy and paste from each other. So everyone claims they have the highest success rate, everyone claims they're the best doctor in town, and patients don't know whom to trust. And the problem is that they get carried away by some of these misleading ads. They end up burning their fingers by going to a bad doctor who cheats them, who takes them for a ride. But they only realize this after the IVF cycle fails. But this is an expensive lesson. And once they've burned their fingers, they're not willing to trust any other IVF doctor. And I completely understand. Which is why you need to arm yourself with information therapy. And the good news is it's very easy to do this. You don't need to go into an IVF lab to find out if the IVF clinic is good or not. You don't even need to talk to the doctor. You just need to ask the IVF receptionist, do you provide embryo photos to all your patients? And do you do only blastocyst transfers? Now, if the receptionist has no idea what a blastocyst and no idea what an embryo photo is, that's a huge red flag because obviously they're not doing the right thing by their patient. And you should walk out of that clinic as soon as possible. And in fact, not even go to that clinic in the first place. But when you know that the clinic provides embryo photos routinely to all their patients, you know that you're on the right track.